now, we welcome Oregon Democratic Senator Ron Wyden, Tennessee Republican Senator Lamar Alexander, and Maine Republican Senator Susan Collins. You are all wonderful to come on this great evening. Thank you ever so much. Ms. Collins, let me go to you. I have some excerpts of the speech. You may already have the entire speech. I don't know if the government option is in the speech or not. But many people say you are thinking about compromising, and I'd like to hear your take and your thoughts before Mr. Obama takes center stage.
I don't support a government option. I'm convinced that we do not need that to improve the insurance market. What's more, I think the creation of a government plan would likely cause the collapse of the private market. And thus, people who like the insurance that they have now could well lose it. So I don't think that's the right way to go at all.
Ron Wyden, thank you for coming back on. It's great to see you again.
Good to be with you, Larry.
I want to get your thoughts on choice and so forth, but let me just ask you to respond to Senator Collins. Some studies have, in fact, shown that a government insurance option might take 60, 70, 80 million people out of the private insurance sector and put it into that option. Your thinking on that?
Larry, rather than speculating, why not go with a proven model? What I've been in favor of is making sure that all Americans have good quality, affordable choices like their member of Congress. 15 United States senators of both political parties are behind that kind of idea. It ensures that insurance companies can't discriminate against them, but most importantly, it provides choice and real competition. I don't think we ought to be speculating about what's going to work. Let's go with something proven.
You have come out, I think, just to follow up, Mr. Wyden, before we get to Mr. Alexander, I believe you've come out in favor of interstate insurance. I believe you've also come out in favor of giving the individual consumer, patient, or family the tax breaks for choice and competition. If that's the case, do you expect to hear any of that from Mr. Obama tonight?
I'm certainly hoping, Larry, that the words we will hear repeatedly tonight are choice and competition. And the fact of the matter is, if you change the tax code so as to encourage markets, most middle-class people will get a tax cut. Under the bill I'm interested in, the typical middle-class person would get a credit or a deduction of just under $18,000. A typical family spends about $13,000 on a basic health care package. Under my proposal, if you shop for health care, if you use the marketplace, you're going to get a tax cut.
Senator Alexander, you've heard Senator Collins, you've heard Senator Wyden. Mr. Obama is going to speak in just a little while. What is your own thinking on this, and are you open to some sort of compromise at this stage of the game?
Well, of course I am, and I think President Obama, I would say respectfully, should listen to the American people, listen to Senator Collins, and listen to Ron Wyden. I mean, Ron Wyden and Senator Bennett have the only bipartisan piece of legislation, which is a framework. I'm a co-sponsor of it. Doesn't add a penny to the debt. Doesn't have a government option. It actually reduces the government programs. It gives people money to buy their own insurance. Senator Collins is making a very important point. If you tell the employers of America, where 177 million people have employer insurance, that if you just pay the government $750, you won't have to provide your employer insurance, millions of them are going to drop their employer insurance, and all those people are going straight to the government option. Now, the president doesn't tell you that when he talks about the government option.
Senator Alexander, do you think a majority members, let's say, of the U.S. Senate agree with your point of view? Because people are tallying up the votes right now. There's a thing running up on top of the Drudge report that the votes are not there for the government option. You've expressed your view. It's not dissimilar to Mr. Wyden. It's not dissimilar to Ms. Collins. Do you think that's where centrist thinking is in the U.S. Senate right now?
My judgment would be that centrist thinking would be to start over, to listen to the American people and start over, to focus first on cost, and either use a framework like the Wyden-Bennett bill, or to just start going step by step on some things we can agree on to re-earn the trust of American people. For example, we could agree on a small business health insurance plan to allow small businesses to pool their insurance and provide low-cost insurance to many more employees.
Senator Collins, in the excerpts from Mr. Obama's speech, which we have, I don't have the full speech, but I want to ask you about this quote. If you lose your job or change your job, you will be able to get coverage. Now, he doesn't say you'll be able to get the same coverage. He says you'll be able to get coverage. How do you read that?
Well, I think he's talking about creating some sort of insurance exchange where people who may have pre-existing conditions could still get coverage without worrying about losing it. That concept's not a bad concept, but the problem, as Senator Alexander has explained, is the proposals that have been put forth would cause a lot of people to lose their health insurance and drive up the cost for others. For example, Senator Baucus's proposals and others that I've seen would allow only 4 or 5 different kinds of plans to be offered. That could well drive up the cost of insurance for people who now have high deductible plans, for example.
And how do we get around the, poor health, pre-existing conditions? How do insurance companies pay for that and still stay in business, Senator Collins?
Well, that is a key question, because if you let people be uninsured until they need insurance, you create adverse selection, and that means our whole insurance system doesn't work because it's based on spreading risk. And that's why these insurance reforms, which we're all for and which are important to make sure that we do, have to be accompanied with some sort of proposal to require people to take responsibility for being insured. They can't wait till they're sick in order to get insurance. But if you're going to do that, you clearly need to provide tax credits to help low-income people. And that's why a focus on cost is so important. At the center of this is the need for cost containment and to avoid exploding our budget deficit beyond what it already is.
I'd like our other distinguished panelists to weigh in on what Ms. Collins is talking about. Senator Wyden, I think the issue of pre-existing conditions and ill health and so forth is a huge issue for the American people. How can we pay for it, and how can we execute it satisfactorily, sir?
Larry, you've got to declare it illegal to discriminate against people with pre-existing conditions on day one. And the way you hold the cost down for everybody, is to make sure that folks go into big risk pools. Because when you have these large risk pools, the way members of Congress do, you can spread the cost and risk. You also hold administrative costs down. Right now, the small business person often spends 20-25% of their health insurance dollar just on administration. So we've got a proven model. What I'm hoping in the days ahead is Lamar and Susan have been very constructive. I hope they can help us round up some votes for our proposal. It is the only bipartisan proposal, and if we can't do that, I am going to be taking market-oriented principles into the Senate Finance Committee, on which I serve, based on the ideas we're talking about here today of choice and competition, because that's how I think you drive premiums down. That's how you get the best deal for the consumer. And frankly, those principles are principles that win support across the political spectrum.
Senator Alexander, give you the last word. On the issue of the risky pools for preconditions and the generic issue, Senator Alexander, which I think is troubling millions and millions of Americans. We saw it during the summer. If we're going to expand the volume of uninsured, if we're going to expand or eliminate the preconditions and expand the risk pools, if we're going to expand coverage with a new entitlement, how do we pay for it during a time of exceedingly difficult financial conditions in this country?
It's very hard to pay for, and if we don't build on the Wyden-Bennett framework, which is the only comprehensive way I see that would make sense, I think we ought to start over, and instead of trying to do comprehensive, which we don't do very well here, we didn't do it very well with immigration, we haven't done it very well with the economy-wide cap and trade, let's just take a few steps in the right direction, begin to control the costs. A few steps in the right direction will still get you where you want to go. It just might take a longer period of time.
What would your first small step be, Mr. Alexander?
I would give small businesses the opportunity to pool their resources and offer lower cost insurance to their employees. We have that ready to go. It's supported by Democrats and Republicans. That would be step number one. Then selling insurance across state lines would be number two. 3, we might be able to make illegal some pre-existing conditions. And fourth, we might be able to do something about junk lawsuits that drive up costs. That would be 4 good steps to start with.
All right. Due to time constraints, you all have to get into the chamber. I would love to talk to you for the remainder of this hour. Believe me. Senator Ron Wyden, Senator Lamar Alexander, Senator Susan Collins, thank you ever so much for helping us.